Hello, my name is Jessica Cagle, and I'm here with my teammates Eve Stoffel, Ryan MacArthur, Tom Hickey, Catherine Craven, and Liam Canty. We're excited to present our recommendation that UnitedHealth Group should acquire Quest Diagnostics. UnitedHealth Group, or UHG, is a publicly traded, for-profit managed healthcare company headquartered in Minneapolis, Minnesota, that employs over 325,000 people. Today, it's the largest health insurer in the US and serves more than 50 million people worldwide. UHG is comprised of two complementary but distinct business lines: Optum for health services and United Healthcare for health benefits. Optum was created in 2011 and is the company's technology-focused arm. It's made up of Optum Health, Optum Insight, and Optum Rx. United Healthcare offers a full range of health benefit programs for individuals, employers, and Medicare and Medicaid beneficiaries. UHG's financial performance in 2019 positions the company for a strong 2020. The company earned about $242 billion in revenue over the course of the year, a 7% increase from 2018. At an investor conference in December, UHG projected that its revenue would grow by another 8% in 2020. UHG's value proposition isn't just its access to more than 48 million people enrolled in its health plans, but its ability to use real-time data sharing to help better anticipate people's care options and to reduce gaps in care. And now I'm going to hand it off to Eve to talk about Quest.
Great, thanks, Jess. So Quest Diagnostics is another publicly traded company that provides clinical laboratory services in both the general and advanced diagnostic test area. Quest also provides advisory services to other professional laboratories, as well as home-based population health risk assessments. Quest has a really large footprint within the United States, with 40 billion patient data points and access to 90% of insured lives. Quest will see in a given 3-year period about 50% of US adults, and it serves 50% of US hospitals and physicians. Quest's core competency is really its ability to compete on price due to its economies of scale and extensive logistics network. Quest has made really significant investments in its intellectual property and its highly skilled workforce of clinicians and phlebotomists. Quest controls about 8% of the $82 billion US laboratory industry, which is itself growing at about 2% per year. Quest has strong earning potential with almost $200 million in net revenues. Quest net income has increased by nearly 17% from 2018 to 2019, and the majority of Quest diagnostic sales growth has been organic.
So this merger seeks to address a gap in the healthcare system. In terms of operations, the lack of integration between payers and lab services slows down the delivery of care, which introduces heightened cost as well as risks to patient health. Specifically, the current pathways that patients use to go from initial diagnosis to full treatment involves visits often first to a PCP, then to lab services, then returning to their PCP who interprets their labs, and potentially referring out to a specialist who may reorder a batch of labs in their own style, and then finally deliver them a plan of care going forward. This results in multiple visits and multiple trips to the lab that, if there was an integration between payers and lab services, could be avoided with broad-based screening. Additionally, on the data side, the limits in sharing between payers and lab services results in less provision of accurate benefits to where the population is today and where their risk lies in the future. By integrating these two groups, you could allow the actuaries and benefit design teams to work with this data to design benefits that are both more efficient and better fit to the populations they serve. And Tom will discuss this merger in more detail.
A brief note about the other companies that were considered for the merger with UHG. The entire diagnostics and medical laboratories market was investigated. The market is somewhat fragmented, with 54% of revenue going to large corporate players. Of the 54%, only LabCorp and Quest retain enough share to ensure they have the scale and data necessary to make the acquisition worthwhile for UHG. LabCorp was considered for acquisition, but ultimately was not picked, largely due to financial considerations. LabCorp has a 35% larger market cap than Quest and trades at a PE ratio 26% higher. To justify this additional cost, research would need to indicate that acquiring LabCorp offers significant strategic opportunities that Quest cannot provide. Given Quest has access to 90% of insured lives in the US and performs over 3 million tests every week, LabCorp's price could not be justified. Next, let us consider the value created through acquisition. The greatest value comes from the insurance side of UHG. Quest has produced significant amounts of data that span populations across the US. United's insurance business can use this data to inform their actuarial models and more accurately predict health trends. This will allow UHG to set premiums more accurately and better target programs for cost reduction. Beyond these improvements, United's insurance business will now have the data necessary to create more robust incentive programs for its members. They can use Quest data to create behavior-based programs that incentivize their members to complete preventative care tests and better manage certain health conditions, such as diabetes via A1C tests. Finally, UHG's provider arm Optum also stands to benefit. The vertical integration should allow new opportunities at the point of ordering. Because tests are now administered and reimbursed by the same company, providers should have full transparency into the price of the test, both for the patient and the system as a whole.
Thanks, Tom. So now I'm going to talk some more about some of the new capabilities that will be realized as a result of UHG's acquisition of Quest Diagnostics. Of cost reduction within the insurance industry is to manage a patient's health and outcomes before it results in costly surgeries or hospital stays, which has proven challenging as much of claims data is all reactionary and none of it is preemptive. So through this acquisition and the subsequent electronic lab data integration, UHG will be able to better predict these patient cost of care rates for inpatient stays. So per a study from the Johns Hopkins University Bloomberg School of Public Health, adding lab markers improved the R-squared prediction of cost by up to 3.7%, high cost patient identification by up to 121%, and inpatient admits by as much as 188%. So with this ability to better predict the patients with the highest risk of complications, UHG will be able to potentially assign case managers or customized communications to help these patients better manage their health. Moving on to the Medicare Part C and D star ratings. So these ratings serve two functions. One, they signal to consumers and patients the quality of the exchange plan being offered or the advantage plan being offered. And in addition, they influence per patient per month reimbursements from CMS. So Halfpenny Technologies performed an analysis that said a 1-star increase in ratings could drive as much as an incremental $16 in per patient per month fees. So for a given population of 100,000 patients, this could, over a year, this is roughly $19.2 million in revenue. So really between these, the ability to drive better Medicare ratings, as well as the opportunity to better identify patients that are at risk of disease and complication, Quest will, or UHG will be able to better perform financially.
Thanks, Ryan. So now that we've addressed how this merger is really going to drive revenue outcomes for shareholders and improve patient care, let's dive into how we're going to position it for success in the marketplace. While it's smaller in scale than the United Optum relationship, it is a new in kind merger that we expect will face a significant amount of scrutiny and challenges on the Hill. So in order to prepare and potentially combat this, we recommend UHG prepare a proactive response strategy to any anticipated resistance, engaging with different stakeholders, including payers, hospitals, and patients alike. With respect to competitors, we wouldn't be surprised if another large payer jumped in to scoop up LabCorp. And we also expect that patients respond with some data privacy concerns. Hospitals and other providers might worry about increased consolidations. And we are going to respond by leaning in on our corporate narrative, the cumulative cost savings for providers, the revenue increase, and incentive programs for individuals that will introduce to assuage those fears. This merger is going to add tremendous value to shareholders, address existing inefficiencies in the space, and improve health outcomes. So for all these reasons, we're really excited to endorse it and recommend it here.